Good evening from Greece and Thessaloniki. So we had a couple of questions about correcting LLD, the leg discrepancy. So I would like to highlight some points here. First of all, when we speak about LLD, we have to consider that it's difference between the right and the left side more than 1.5 or 2 centimeters. Up to that difference, it's a normal difference that we all have, like human beings, that we don't have to do anything about that, not even using insoles. So if we go and let's say that we have a patient that he has more than 2 centimeters, then we can further divide it from 2 to 4 centimeters and more than 4 or more than 5 centimeters. So depending, the technique that we're going to follow depends on the total leg discrepancy. Sometimes we have to calculate it. So let's say that we have a kid that it's nearly 8 years of age. So and the patient has, let's say, 3 centimeters of difference. We have to know that this difference is going to get bigger and bigger until he reaches his skeletal maturity. So we have some applications that we use in pediatric orthopedics in which we can calculate the total difference once this kid is going to reach the skeletal maturity. So let's say that we have a patient that is going to reach up to 4 centimeters. Then most of the times we prefer less invasive techniques. One of these is the 8 plates technique, in which we stop for a very specific time of period, let's say for 1 year, 1 year and a half. It depends on how much difference we have to cover. So we stop the normal lengthening of the healthy side, and with considering that the pathological one, let's say that the right one is the shorter one, is gonna have time to reach the normal one. So with that technique, which is a very minimal invasive technique, we use like 2 to 3 centimeter incision. We put these 8 plates there, and once we have the desired result, then we can just remove the plates, and that's it. Once we start speaking about discrepancies more than 4 or 5 centimeters, then we have to consider lengthening the pathological side. It can be done with osteogenesis. It can be done with lengthening of this pathological side, and it can be done with circular frames, which is we use pins and frames that the patient can see. It's not that much friendly when we have to do with kids. And the last 1 or 2 decades, we have successfully used the implantable intramedullary nailing that can be distracted. So we put the nail inside the body of the patient can't see anything, and by using a device outside onto the skin, for example onto the left femur, which is the short one, we use this device in order for this nail to become bigger and bigger and bigger, and with this way we can lengthen up to 8 centimeters of difference. Of course, once we have a kid or a patient that, let's say, the calculated difference is going to reach, let's say, 12 centimeters, then we have to do a staged procedure, which practically means we have to do femur 1 time, and on the second time we might have to go and do the tibia in order to get this total 12 centimeters of lengthening. So these are the most common and the most famous techniques that we use in pediatric orthopedics to fix the LLD.